what the most common forms of thyroid issues are. What's up, Fayday? I'm sorry, Faydak. Amy, what's up? So, again, my name is Dr. Ian. It is Wednesday. It is 6:30. We are rocking again. We're going to do a little lecture here. We'll do maybe 75, 90 minutes or so. So essentially ground rules are, guys, just keep it, keep it classy. Try to keep your comments at least legible and hopefully not worthy of banning. But anyways, we're going to always have people that are going to be upset about what I say and the functional medicine concepts. But the reality is that I think a lot of what I'm going to say tonight is going to resonate with people, people that have been struggling with not just thyroid issues, but outside of not knowing, is there something else besides my thyroid that are causing a lot of these thyroid symptoms? Okay. So with that being said, again, I've been practicing functional medicine for 15 years. I had a physical office for 13 and a half years here in Boulder, Colorado. I'm just exclusively online now, meaning we're just doing Zoom consults. There's myself, a clinical nutritionist, and I also have a doctorate of nursing, Dr. Joe. And so we have 3 people on staff with Dr. Autoimmune. And also, obviously, what I'm doing here is educating you guys tonight. This is my favorite lecture. This is my favorite lecture that I like to do. This is essentially thyroid dysfunction. Never thought that I'd be considered a thyroid expert. Never thought I'd be featured in a nationwide documentary. Never thought I'd see thousands and thousands of thyroid clients. But this is really what actually, again, is the bread and butter of my my functional medicine practice. So what we want to understand is what is the actual physiology behind why the thyroid falls apart. Why is it that your TSH can be normalized by medication, yet you're still struggling with anxiety, brain fog, fatigue, inability to maintain normal weight, or you're still having hair and skin and nail issues, again, insomnia, or your voice is hoarse, so you're seeing swelling on your throat. And again, it seems like it's very perplexing to the medical profession, because essentially all they're going to run, right, is this marker right here. So we're going to go through the ins and outs of what I've been seeing for the past 15 years. And hopefully you're going to start to understand and see some of these symptoms that you're experiencing are actually, again, right, symptoms are reflections of systems. That's one of the most important concepts in functional medicine, is if you understand the system that's, again, right, driving the symptom, then we don't have to practice just based off an antiquated model. And this is a pituitary marker, it's not a thyroid marker. So you can start to understand, where do we actually start to apply things like supplementation, dietary interventions, the appropriate labs, start to find your root causes. Okay? Yes, so we're going to be talking about Hashimoto's. Okay? Okay, so again, listen. Do the best you can, you guys. Ask questions. I'll be in and out of answering questions, because I'm going to be talking and I'm going to be covering a lot of information here. I'll try to answer as best I can. Just understand that I'm going to reserve the last 15, 20, maybe up to 30 minutes to do Q&A with you guys. And so we'll just rock the house, and we'll see kind of what happens. But again, hopefully you guys will be pleasantly surprised, and hopefully you're going to get a lot of ideas about maybe what you haven't done so far. So you can start to basically either ask your doctors, have intelligent conversations with your providers, or you may say, hey, it sounds like maybe this guy has worked with a couple Hashimoto's or a couple hypothyroid clients or a couple thyroidectomy patients before. Maybe he actually could look at my case from a different lens and help me be the best version of myself, because this is really all that it comes down to. Again, I suffered significantly. I developed celiac disease myself in grad school, and so I turned on, right? I had genetic predisposition, there was environmental factors, I had triggers, and the key fourth component was I turned on this process called leaky gut. So once I did that, there was really no looking back. I can't go back to gluten, but I had many things that led me down that path. So now I can look back at that experience and say, I'm blessed, I'm fortunate, because I love life and I'm living the best version of myself and helping other people do that as well. Okay? So guys, that's what we're gonna hit up tonight, and we'll go from there. So again, just so you guys also are aware, Like I mentioned, again, I was featured in 2014 in this documentary right here. It's called The Thyroid Secret. This is from Dr. Isabella Wentz. Basically, the story was she was living in the Colorado area. She found me on Google because of my search engine optimization, mainly just because of my reviews of clients who had autoimmune thyroid issues. They reached out to me. So in episode 9 of this documentary series, Success Stories, they utilized my clients as pretty much the people that they were giving testimonials for the functional medicine process. So again, no stranger to we're looking at complex and chronic conditions. And again, we're just going to look at here are the reasons why. And as you start to understand, oh, wow, maybe I haven't looked at blood sugar, I haven't looked at my environment, I haven't looked at my gut really closely, you're going to start to understand why you're still suffering with symptoms. It does not have to be the case, but we do have to make a decision that we're no longer going to accept that, and we're going to move on from that, but we're going to start doing things differently. So yes, Willie, leaky gut. We'll definitely be talking about leaky gut tonight, okay? So you can't get away from the gut stuff. It's just, again, if the majority of your immune system is in the gut, well, you're going to have to, again, address the gut if you want to have resolution of the immune system. So again, like I said in the beginning, if we're dealing with symptoms, okay, so again, classically, if we've had weight gain, especially on low-calorie diets, or if you've been restricting calories but you're still gaining weight, if we have poor hair quality, nail quality, breaking nails, skin quality, dry, if you're actually seeing puffiness, fluid retention in the face, okay, symptoms of hypothyroidism, but also really just thyroid disease. Classically as well, a lot of times you're going to see swelling in the lower extremities. We're going to see definitely elevations of that marker if we're truly hypothyroid, but it also depends on where that TSH is fluctuating if you actually catch it accurately on lab testing. And this is one of the things that gets providers tripped up. You can't just rely on one test of TSH to determine if there's a thyroid problem or not, okay? But beyond that, I think there's a lot of other symptoms that people are dealing with, right? It's going to be brain fog, right? Fatigue, intolerance to cold, anxiety. When anxiety goes on long enough, many times people end up becoming depressed. And so there's this really just, a lot of times just people don't want to get out of bed. Literally just hitting that snooze over and over and over again. And then on top of that, again, a lot of times we'll see that throat swelling and actually difficulty with swelling. That you'll see actually sometimes, yes, there's nodules on that thyroid. We'll talk a little bit about what, again, my recommendations when it comes to nodules. But on top of that, again, really the biggest thing is that people just don't feel themselves. They know they don't feel themselves. They know they're not able to contribute. They're not being the best version of themselves. They're not the best husband. They're not the best spouse. They're not the best mom. So now, again, the question is, you go to your doctor, right? And they said, hey, if you're lucky, if you're one of those lucky ones and the TSH is elevated, we call that, right, hypo, which again is essentially because this is a pituitary marker, right? The TSH is acting on that butterfly-shaped gland, the thyroid. Okay, it's kind of an ugly butterfly. But TSH is acting on that thyroid, requesting it to produce both T4 and T3. All right? So what happens is if you have hypothyroidism, right, because the thyroid's not responding, so the TSH is going to go up. That's how that works. It's inverse. It's a little bit weird to think about it, right? Because when TSH goes down, we call that hyper, and typically that's also associated with elevated T4 and T3 levels. Now, you go to your doctor, they pull out their prescription pad, and they go, oh, well, we're going to give you levothyroxine or Levoxyl or leothyronine, that's T3, right? Or maybe WP Armor or Nature-Throid, and they're a little bit more in vogue, they're a little bit more hip, so they're going to give you some natural alternatives, okay? And then what happens is, hey, 6 weeks later, you come back, the doctor's like, check it out, your TSH is normal now. And you're like, well, yeah, but I still have brain fog, I'm still cold, I still can't manage my weight, I still have anxiety, still have depression, I still have insomnia. Like, what is anybody dealing with these issues? Are you guys seeing this stuff where, again, maybe you got a diagnosis, you took medication, but you're still suffering? Yes. Okay, this is for you guys tonight. This is the lecture that, again, that really, for me, allows me to help you guys understand why you guys are still dealing with these issues. I don't care if you've been dealing with 2 years or 20 years. When you start to understand the mechanism of why you're losing the feedback, okay, then you can start to do things differently. Because again, your provider, all they're gonna do is they're gonna treat your number. They're not gonna treat you. Okay? Are we there yet? Yeah. So again, first step is saying, hey, again, how does this endocrine system work in the first place, right? So like I said, the thyroid is producing both T4, right, and T3. Well, about 93% comes out as T4 and roughly 7% comes out as T3, okay? T4, that's 4 iodine molecules. T3, 3 iodine molecules, right? The difference is huge because this is essentially biologically inactive, and that is what actually is active. So what's going to happen is when you're producing thyroid hormones, okay, through an enzyme called TPO, thyroid peroxidase, that enzyme helps us produce our T4 and T3. Now, here's what happens, right? T4 has to hop on the shuttle, right? That's called thyroglobulin. Okay? It's literally physically like a bus. It's a protein, grabs onto that thyroid hormone, and it transports it to different locations in your body. You can't just make a bunch of thyroid hormones. Again, that's your metabolic energy. And if you ever experience too high of a dose of T3, cytomel, or if you've ever gone into a hyperthyroid spell, like, again, inward trembling, nervousness, anxiety, hair loss, insomnia, it's awful. It also, on the extreme side of it, right, it can start to provoke something called a thyroid storm, and that's life-threatening. That's a blood pressure elevation, which actually could lead to strokes, pulmonary embolisms, bad problems. So this thyroglobulin is literally a protein that shuttles, right, 60% of that T4 into the liver, right? We have another 20% that's going into the gut, and then the rest of it's going to actually be in peripheral circulation as well. So the first thing, you guys, right, that you need to understand is that this is one of our key components as far as why people are still struggling with thyroid symptoms, especially those that have normal TSH. So again, listen up. This is really important. What I'm going to say next may have been one of the reasons why you have a thyroid issue and why you're still struggling even if you're on medication. Okay? So since this protein shuttles, again, T4 essentially to cells, okay, one of the main influencers or the main inhibitors of the ability to shuttle those thyroid hormones is if your thyroglobulin goes up. So if you increase that, and especially if you also then increase something called sex hormone binding globulin, so both this thyroglobulin and sex hormone binding globulin, what's going to happen is you're going to actually reduce the available thyroid hormones in your circulation. So, who knows what causes this? Does anybody know what happens and why you would actually increase your thyroglobulin or your sex hormone binding globulin? Like, what is it? What is one of the most common medications that is given, especially at the beginning, typically, of menstruation of millions of Americans? Women. But lack of selenium and iodine is a very good idea. There it is, the pill, birth control pill. Estrogen, yes. And actually also progesterone. So there's progesterone-based birth control, right? There's estrogen-based, which is going to be the most dominant, has the highest, it's like over 99% effective, right, as a birth control. But what's going to happen here is literally when you take, right, birth control, and that's IUD, that's pills, it doesn't matter, right? You are upregulating binding proteins. So what happens is you actually have less available less available hormones to bind to the receptor, and it's not going to show up on a blood test. Yet you can have all of the thyroid hormone symptoms. Yeah, so it's a form of an endocrine disruption, essentially. And so again, the reason why this is important, here's a crazy thing. So when we're actually greater than 10 years, statistically greater than 10 years of use of birth control will increase your chance of developing hypothyroidism by 400%. You are 4 times more likely to develop hypothyroidism if, yes, and this is including perimenopause. Because again, what may happen is that you actually see a significant fluctuation of hormones as you go through menopause. And many, essentially, women, again, have significant immune system shifts, but this may actually show up. Now, again, on the initial 90 marker panel, and something that every single thyroid sufferer needs to measure is their sex hormone binding globulin. Okay? I do a 14 marker hormone panel outside of my regular thyroid marker panel. I do an 8 marker thyroid panel, and we'll talk about those markers specifically later. But it's important to understand that this little pill that you may take, or again, an IUD that you have in, is not innocuous. It's not like, oh, it's just this bystander. No, you're changing pituitary feedback. And as a result of that, you can start to increase these binding proteins. And this is a significant reason why we have thyroid disease as the #1 endocrine diagnosis in the United States. And it is, yes, it's affected by progesterone and estrogen. Okay? So the longer you take that, the more likely that we'll develop an issue. Now, later on, we're going to talk about root causes again behind especially autoimmune conditions. And so one of the mechanisms that actually is most common to dysregulate hormones is insulin resistance. So when you start to understand that your blood sugar is not just about like the fact that you need a Snickers bar, the fact is that your blood sugar actually may be now causing another system to have failure. And this is why we have to start to understand what your specific root cause is. When you start to make, again, better decisions on your diet, when you start to stabilize your blood sugar, when you actually get your nutrients upregulated to stabilize your blood sugar, when you remove toxins out of your system, which will help you stabilize blood sugar, guess what? Inadvertently, other systems connected to that will also start to improve. Yes, exactly. And so this is the craziness. This is the insanity. We have a massive dependency, again, on medication to try to regulate menstrual cycles. How many women out there, or even in our live right now, dealt with irregular menstrual cycles as in their teens when they first started menstruating, got diagnosed with PCOS, told they had fibroids or maybe endometriosis, or just told that, hey, look, you have a bad cycle, we're just going to give you birth control. Yeah, don't worry about it. And it's like, wait a second. What do you mean don't worry about it? What we're doing is we're kicking the can down the road because we're not addressing the fundamental root cause behind polycystic ovarian syndrome or endometriosis or estrogen dominance. Okay? Right? I mean, it's a reasonable thing to talk about. And so these are the conversations that I have with my clients all the time. Like, what is it that we should be doing? And what is the best thing we can do so that you don't have to have dysregulated menstrual cycles? Because literally, you should 3-day menstrual cycle, have 1 day of significant flow. Other than that, maybe some spotting. You really shouldn't have mood changes or tender breasts, right? Or cramping or significant bloating. That's not normal. But yet again, remember, average and normal are confused every single day. Because so many women in our society have those symptoms, it becomes normalized instead of us understanding that it's just average. And average is not acceptable, right? Who wants a C average? I don't want a C average. I'm an A student. I'm also a type A personality, but I want the best grade possible, right? What's up, Glenn Frank? Join the team. Good job, man. And again, just so you guys know, if you guys actually join my subscription service and I see that, right, when you ask a question, I'm going to preferentially answer your question as well. It's only fair. It's $9.99 a month, less than the cost of 2 Starbucks. So if you guys do want your questions answered preferentially, you'll just want to join my subscription. There you go. We're not talking prescriptions tonight, okay? So again, this is one mechanism that's important. Remember, again, if you guys have normal TSH, but you have all the symptoms of hypothyroidism, make sure you're checking the sex hormone binding globulin, look at your thyroid globulin levels. That may be one of the root cause mechanisms of why your thyroid is not functioning optimally. Okay, anybody can order those labs. We get those labs on every new client that comes into our virtual practice, and it's important because you need to have someone say, this is the problem, this is not the problem, stop spending money over here, this is where you should be focusing your attention and efforts because that's actually going to get to the results you're looking for. Now, I also mentioned, right, that 60%, 60% of that T4 converting into T3, right? So again, this is reflecting of T4 to T3 conversion. Same thing, 20% of T4 to T3 conversion happens in the gut in the presence of healthy, beneficial bacteria. Now, let me ask you guys this. Do you think people with thyroid disease have optimal, healthy, vibrant, thriving microbiomes? Or might they be struggling a little bit with their gut health? Love your life. Yes, then that is, yeah, their guts are not so good. Struggling. Struggle bus. So again, constipation, right? Very common with hypothyroidism. Very common to see gas and bloating with my thyroid clients. Very common to see flip-flops actually of diarrhea and constipation. And we'll talk more about gut in a little bit. But what I just want to emphasize is that, and this is again why it's so important to do 8 basic markers on a thyroid panel. Because if we actually start to see low levels of your T3, the question is, if T4 levels are normal, you're probably not converting. If you're not converting, again, you're going to have all the symptoms of hypothyroidism. So one of the areas that causes conversion is healthy, beneficial microbiome, like the beneficial bacteria that your gut should actually have and contain. But guess what one of the most common issues is that leads, again, people to the diagnosis of hypothyroidism? What is like one of the most common medications that you're going to see, again, prescribed by primary care within the first 10 years of an adolescent's life? Let's say you had chronic strep, you had otitis media, right? Let's say you, right? Not NSAIDs, yeah, I mean, for sure. But what I'm getting at is what's going to really, really hamper your gut. There it is, antibiotics. So antibiotics, when you get prescribed antibiotics, what happens, right? You have an enzyme called 5' deiodinase, and you squash that enzyme because you just killed off all the beneficial bacteria. So also one of the statistics of developing hypothyroidism later on in your life is that, guess what? You had early exposure to antibiotics. And what's crazy is that we know, like there's an actual protocol. It's not hard. You just need to have the right supplementation to make sure you stabilize your bacteria and save as much as you can if you have to do antibiotics, because sometimes you just have to, right? But unfortunately, again, physicians are not trained to utilize correct supplementation to stabilize those colonies of beneficial bacteria, because your bacteria are everything to your immune system. Okay, so again, this is why we need to say, okay, well, we're going to have to take a gut-forward approach, a gut-centric approach in working on something as dissimilar as a thyroid problem, because again, that's going to be one of the epicenters of your immune system. We know that about 70%, right? Well, Love Your Life just said, why aren't they trained like that? Remember, There's no patent, right? They can't control a lot of the supplements that are out there. And there's no pharmaceutical interest that is going to look at supplements and say that that has a high enough profit margin. So this is, again, this is the dysfunction is that, again, medical school is funded and guided by the pharmaceutical industry. So again, don't be surprised when your doctor doesn't know how to do any of this stuff unless they've kind of gone through like functional medicine programs. And most of the functional medicine programs out there, it's a bunch of burnt out medical doctors because they're tired of the same thing you guys are tired of. They're tired of just cutting scripts. They're tired of the revolving door of people having to come back. They're tired of people seeing people discharged, from hospitals only to come right back with the same issues because they're not taught how to look at people's lifestyle, how to individualize and use precision medicine to actually start to say, hey, what is the body lacking and what is in excess? That's the two most important fundamental principles behind functional medicine. What do you have in excess and why? And what is deficient and why? And as soon as you start making the right, correct changes to those things, guess what? Your life will change. Your symptoms will start to go away. The anxiety starts to fade. You'll start to sleep better. Your gut symptoms start to go away. You actually can thermoregulate your temperature. You'll normalize your TSH, and it's not because you're taking a medication, it's because your TSH is a feedback on the entire system. So again, I don't get worried when people have elevated TSH. What I want to know is, and when the system is broken, is when you have high TSH and low T4. That is a diagnostic criteria for hypothyroidism. It's not just an elevated TSH. An elevated TSH means your thyroid is struggling to keep up with the demand. And that's it. And then you have to do the due diligence in figuring out why is that happening. Okay? Love your life. I'm looking forward to it. I can't wait to see you, man. We'll get you in here usually in the office within a couple weeks. Okay? So again, there's that link in the bio and it's $350. We'll talk about that more at the end, but that gets you a 90 marker blood panel and that's 90 minutes of my time. Okay? And I'm gonna lay it out there. I tell my clients this all the time. If you are not blown away when you come out of that initial appointment, I'm not doing a very good job. Because I should be able to point out to you things that have never been pointed out to you before. The things that I'm talking about tonight, but it just gets individualized per the person. And that's why functional medicine is so beautiful, because you can look at your timeline, you can look at your history, you can look at your systems, you can look at good biochemistry and labs, and you start to check boxes. And as you start to check those boxes, as your body starts to heal, your symptoms will go away. It's not science rockets. This is not crazy stuff. This is not incense and beads and chakras. No offense. But this is evidence-based medicine. It's just tailored to the individual. Okay? So, yeah, fibromyalgia is 100% a Band-Aid diagnosis. Okay? So, again, interestingly enough, a lot of people, so if you have fibromyalgia, guys, you have a higher chance of having hypothyroidism. If you have hypothyroidism, you have a higher chance of developing fibromyalgia. So back over to here, that conversion of T4 into T3 also occurs in the liver, and that's 60%. And again, you guys can have perfect AST, perfect ALT, perfect GGT, perfect alkaline phosphatase enzymes. You may have elevations of enzymes, which again is usually insulin resistance, but your liver enzymes may be perfect, okay? And that doesn't mean that your liver's okay. Because again, right now we have an epidemic of problems with people's livers. Now, one of the big issues is they're called persistent organic pollutants. These are chemicals. We know that the higher that TSH number is, the more likely you have an environmental component as a root cause behind why you have a thyroid problem. That could be lead, that could be gadolinium, that could be antimony, that could be mercury, that could be mycotoxins, mold, illness. Okay? That could be BPA, bisphenol A is a known teratogen, but it's also actually something that is primarily a endocrine disrupting chemical, especially to the thyroid. So literally the higher that TSH, the more likely there's probably actually an environmental component. But again, keep in mind, we were just talking about, hey, a lot of people still have thyroid symptoms even though your TSH is normal, okay? So again, persistent organic pollutants, but also I will say that the number one thing that really dysregulates the liver is going to be insulin resistance. Again, you may have a completely perfect A1C, okay? So let's say, man, you might have a 5.2 and your doctor's over the moon. Oh my gosh, your A1C is perfect. And yet, did they run your insulin? Because we run insulin on every single client, and it's about 80% of my clients have a dysfunctional elevation of insulin. So here's what happens, okay? When your insulin's high, that's what's keeping your A1C down. And so people don't understand that, hey, look, that is massively important. It'll interfere with the conversion of T4 into T3, okay? So it's not just this like, oh, I'm fatigued after meals or I'm craving sugar all the time. Anybody? Craving sugar? Fatigue after meals? Two most common symptoms for insulin resistance. So the important thing here is to understand is that one, you're not getting the right test. A1C tells you jack squat as far as if you actually are insulin resistant until you're in the later stages of insulin resistance because your insulin can't keep up anymore, right? So if you're at like a 6.4, we call that type 2 diabetes. Seen literally probably close to 1,000 people in my practice reverse type 2 diabetes. But it's because we're figuring out why they're becoming insulin resistant. So here's again the bigger issue, right? When you have a high level of insulin, okay, you will make fat cells. Fat cells are not innocuous. They will start to upregulate estrogen. Ooh, wait a second. So when you start to increase estrogen, you actually start to change the ratio of estrogen to testosterone. And not only does it obviously cause estrogen dominance, but you lose one of the most important immune regulating mechanisms in your body. Your ratio, ladies, of estrogen to testosterone is critically important to your immune system. So guess what happens? When you become abnormal with that ratio, you create inflammation. Guess what inflammation does? It makes insulin resistance worse. And then you make more fat cells. And fat cells make more estrogen. You lose that ratio, and then all of a sudden you become more inflamed. And yet your doctor is going, oh, well, I guess you're menopausal, and we're going to give you testosterone, we'll give you estrogen. I mean, I have doctors that are recommending estrogen for women who've had hysterectomies because of endometriosis. I'm like, it is wild out there with hormone replacement therapy. Yes, it's fixed. Again, I tell you what, through supplements, through glandulars, I can manipulate your physiology. I can make your physiology look good, but that doesn't mean that your symptoms are in line with optimal biochemistry. When your symptoms, when you're thriving and your labs are thriving, that's when we're kicking ass for you. So this vicious circle right here, right here, because check this out. Guess what's the ratio of men to women with thyroid dysfunction? So for every 7 women who have a thyroid issue, there's 1 guy. 7 female. 7 out of every 8 cases of hypothyroidism are female. What? So is it possible that hormones play an issue? Right? Phoenix 65 is, so well, what should we be asking before? What testing should we be asking for? Unfortunately, when you look at blood testing, let's just take an example of blood testing, okay? There's strengths and weaknesses of every form of test, period. Doesn't matter if you're MD, DO, naturopath, that makes no difference. The lab test is going to have benefits and it's going to have limitations. So one example is when you check estradiol. First of all, there's no reference range because those levels will fluctuate depending on your menstrual cycle. Okay, if you're postmenopausal, then yes, you should be under a certain number. They'll still not list a reference range for estradiol if you're postmenopausal. So your doctor is going to be kind of a little bit confused about, well, what is even a normal level of estrogen, right? And what's going to happen here, right, is that we don't have just estradiol. Estradiol is the most potent estrogen, but you have estrone, estradiol, and estriol. So you should be measuring all three of those hormones if you really want a real look at what's going on. Plus, you should be measuring 3 different testosterone markers plus 2 different progesterone markers. So all these things, there's complexity. Hormones are one of the more complex subjects. But once you realize that it's really just a feedback mechanism, there's something driving the enzymes that cause the production of more thyroid hormones, such as insulin. Because look, insulin just upregulates aromatase. And when you upregulate aromatase, you make more fat cells. That's it. But when you figure out, oh, well, what's causing the insulin resistance? Well, could it be your diet? When you start to realize that devices like this is called a CGM. Phoenix 65, no, a rheumatologist won't do that, right? So what I'm alluding to is something called the Dutch test. It's called the dried urine test for comprehensive hormones. Yes, so yeah, LPKO 602. So there's the pros of the Dutch test is it's much more comprehensive, okay? The con of the Dutch test is that it's a urinalysis. So again, it's not blood. Some things are going to show up better in blood versus urinalysis. But another reason why I like the Dutch test is it tells you cortisone and cortisol. So I have seen normal circadian cortisol rhythm tests, which is the most accurate way to look at your stress hormone, okay, which has a lot to do with your TSH. But it's because it's actually being shuttled into cortisone. And if you have a cortisone problem, i.e. if you're jacked up with inflammation, you'll show abnormal cortisone and your cortisol may look normal. So yes, there's still be an adrenal issue there, but it's another advantage of why I do the Dutch test. And again, no, it's not part of my startup package because not everyone needs a Dutch test. So guys, just so you understand, I customize every patient's care plan. I will tell you this, most of my clients, I will recommend a GI map. Like I said, if you've got 70%, okay, of your immune system in the gastrointestinal tract, I'm probably going to be starting with a lot of my clients, and yes, almost all of them, with getting a foundation of their gut health. If your gut health is involved in the conversion of T4 into T3, I am going to recommend what's going on. If inflammation, where does inflammation come from? Mucosal surfaces, right? So when we talk about this leaky gut phenomenon, leaky gut, obviously, again, it's a mucosal barrier issue. It's found in the gut, and inflammation mainly, again, it finds its way into the gut. And as you become more inflamed, so do you become more insulin resistant. So one of the mechanisms, actually, again, that cause non-alcoholic steatohepatosis, right, NASH, which is just insulin, it's non-alcoholic fatty liver. It's non-cirrhotic. It's a non-alcoholic version of fatty liver. That's insulin resistance. But one of the main mechanisms, remember, is that your gut is right there before your liver. So if everything is permeable, coming right through that gut, if your inflammation levels are very high, your liver is just whoosh, is taking the brunt of that. Okay? So that being said, okay, is now we start to understand, oh wow, wait a second. it's not just about TSH. In fact, guess what? If you've had an elevation of TSH, there's a 90% chance of this. So let me write that out. So pity the person that comes in here and sees my full whiteboard. They're like, where do we start? By the way, guys, if you want this lecture, if you came in late, you're in luck. I'm going to load this up to my YouTube page. So all you have to do is email info@drautoimmune.com. Again, that's info, info@drautoimmune.com. And what I'm going to do is after I'm done with this lecture tonight, remember, we'll do a little Q&A at the end, okay? But I'm going to load that up to my YouTube page, and you guys can watch this at your convenience, okay? So that being said, if we've had an elevation, right, of TSH, there is a 90% chance you actually have an autoimmune disorder, and it's called Hashimoto's. Okay, so again, if you have Hashimoto's and you've been diagnosed with that, now you have a 50% chance that you have a second autoimmune disease, and we really don't know what that is. That could be celiac disease, that could be type 1 diabetes, that could be lupus, that could be MS, that could be RA. But we know, at least statistically, if you had an elevation of your TSH outside the lab reference range, remember that's usually about point, oh my gosh, these, we're going through markers today, right? So if like 0.4 to 4.6, again, that's the lab reference range. The American Endocrine Society has published papers on optimal populations, so younger populations, and they say the optimal, right? Optimal is 1 to 2.5, and what I find is actually usually most people seem like their symptoms are most controlled when their TSH is closer to a 1.0. Okay? TSH is thyroid stimulating hormone, Wendy. It's a pituitary marker that acts on the thyroid to produce both T4 and T3. The majority of actually is T4, and then you have to convert that T4 peripherally in your liver, in your gut, and other areas. Okay, so again, we talked about this, but if you guys have been on birth control and if you've had birth control for over 10 years, your chance of developing hypothyroidism has just gone up 400%. So it is an epidemic problem, and people have no clue that birth control may have started them down this path. However, there are millions, literally millions of Americans right now that have no idea they have the most common autoimmune disease in the world. And autoimmune disease just means that basically your immune system has lost control and regulation of the ability to detect what self is and what is non-self, i.e. invaders. So your thyroid gland, right, is treated like a redheaded stepchild. It gets the crap kicked out of it because now you're tagging it with antibodies, and then that's recruiting white blood cells to come in and spew a bunch of enzymes on it, which kills off the tissue. And then guess what? You get a cycle of symptoms up and down of fatigue, and then I'm kind of cold. I gain a couple lbs here. I'm seeing some anxiety. I actually even getting some heart palpitations, and I'm kind of like trembling and nervous. And then my sleep is off. And man, now I'm having gut symptoms, right? So there's an ebb and flow typically of those symptoms that go with the disease process. Does this sound familiar to anybody? Anybody? I'm guessing it sounds, yeah. Exactly, yes. So now, if we have these issues going on, again, just taking a thyroid medication is, yes, it's artificially dropping the TSH back into the reference range, and it's doing absolutely nada. It is doing nothing to the autoimmunity, right? The actual immune system that's driving the process that's causing the elevation of TSH. And in fact, a lot of times people have to adjust their medications and they'll go, whoa. And quite frankly, here's the other kicker. And I was just talking about this. I just posted a video on this today, was that someone was asking me, why do I feel worse when I take thyroid medications? Does anybody feel worse? So it's about 25 to 30% of people statistically actually will feel worse for taking their thyroid medications. You guys, that's classic autoimmunity. Guess what? You're probably making antibodies against thyroid hormones. So again, you can remember the two antibodies, right, is anti-TPO, anti-thyroglobulin. Those are your 1 and your 2 markers for Hashimoto's. But what you may not realize is that you're actually making antibodies against thyroxine and leothyronine, right? So thyroxine, T4, and leothyronine, T3. So this is why people are like, I don't get it. Like my doctor's telling me to take the medication, but I actually feel way worse on it. And I'm like, yeah, because you're probably autoimmune. Now, you may need that thyroid medication. So again, I'm not against medications. I'm not telling people to stop taking their medications. What I'm going to tell you is that your body is an exquisite set of cogs and pieces that fit well together. And when you remove interference on the system, we fix insulin resistance, or we fix your gut health, we correct environmental problems. You know what I mean? Like we get your system working. Guess what? Most of my clients, they start to regulate their TSH on their own. So again, statistically, what I've seen in my practice, look at that. It's a nice mustache right there. It's so random to be like so serious talking about this stuff, and then someone throws a cowboy hat at you with a mustache. You're like, I have to be serious now. Talking about these super serious topics, and you guys just totally throw me off track. So what I'm saying is, right, is that about half of my clients actually have to adjust their medication dose down. About 20%-ish of my clients actually don't mess with their thyroid medication dose at all. And the other 30%, they get off of it and they're fine. But again, it's always whenever you make changes to your thyroid medication, please come back in 6 weeks and repeat your markers, right? Repeat your markers and figure out what's going on. So again, keep in mind, right, again, we have a lab reference range of everyone that's sick, and they're included in that lab reference range. An optimal range for your TSH is really actually between 1 to 2.5. But the bigger question we should be asking is, why do we have an immune system problem that's actually causing us to have all of these symptoms? Why do we have it, and what are we going to do different that's going to actually allow our body to start to heal ourselves as God intended? Okay? Yes, the lifestyle will have to change if you have an elevated TSH. Again, unless you just want to take the thyroid medication. But like I said, the thyroid medication is a hormone replacement. It is not treating your immune system, which is usually the #1 culprit behind why TSH is elevated in the first place. Again, you guys, you can't cure Hashimoto's, but you can put Hashimoto's, you can put Graves in remission. And I'm going to talk about that right now. All right, so back to here. Okay. So remember, if we have, right, Hashimoto's, or really any autoimmune, because honestly, what separates, right, Hashimoto's from rheumatoid versus lupus versus MS, slightly different genetics, okay? Slightly different environmental inputs or infectious issues driving that, and it manifests slightly differently. But a lot of these root cause issues are actually the exact same between these different autoimmune conditions. So again, right, if you have it's kind of another ugly thyroid that we're driving right here, okay? Now we start talking about what are the actual mechanisms that actually drive this issue right here, right? So here, 1, fun fact, the most reactive food that actually drives something called leaky gut, which is a part of every single autoimmune reaction that's out there, right? The number one food that drives that is gluten. Wheat, barley, rye, spelt, oats, triticale, kamut, doesn't matter what it is. Yes, sourdough might have a little bit less of that gluten content, but if you do have a gluten sensitivity, not just celiac disease, okay, because that's a separate entity. Just because you've been told you don't have celiac disease does not mean you can eat wheat, first of all. Secondly, when you get one exposure to gluten, again, gluten makes gliadin, and guess what? Gliadin has similar amino acid homology. It looks similar in protein sequences as your thyroid gland. Tina, I'll answer your question later, my dear. You guys, don't be offended if I'm not taking questions right now. I'm lecturing. I'll answer some questions later. We'll see what happens. We're already at 600 people though, so don't hold your breath if we hit 1,000 as far as me being able to answer everybody's questions, but you guys are always welcome to DM me. Again, if you guys want this whole lecture, you need to email info@drautoimmune.com, and then we will send you the link to my YouTube account. And you guys will have this loaded up hopefully by tonight, okay? So again, gliadin is one of the proteins that gluten breaks down into, and it cross-reacts against thyroid tissue. And it preferentially can drive permeability or leakiness in the gut. Again, what we know now from Alessio Fasana, he's a doctor who figured out the mechanism behind celiac disease. Then he started actually asking the question, well, if this is how celiac disease develops, i.e. leaky gut when you eat gluten, is that connected to other autoimmune conditions? Sure enough, leaky gut is found in every single autoimmune condition. So what you also may or may not realize, right, is that, again, one exposure to gluten may cause inflammation for up to 3 to 6 months. And meanwhile, right, again, here's the kicker. You go gluten-free for 30 days and you're like, it didn't help. I didn't really notice a difference when I went gluten-free. Anybody like that? Like they went gluten-free, someone was like, man, you're gonna feel so much better. And then you're like, I didn't notice a big difference when I went gluten-free. Chelsea, yep, Juliana, absolutely. Okay? It's just at Ian Holloman as far as my YouTube. So if you search for me, you'll find it. YouTube actually took my account down. They didn't tell me why. I appealed it. And they're like, nope, you can't have a YouTube account. So anyways, I may not have been going along with the narrative during COVID. So that being said, I have a different YouTube account now. Okay. So some people notice immediate response by pulling gluten out of their diet. Some people don't. But again, it takes about 21 days for you to remove 50% of those antibodies when you have a reaction. So that may not mean symptomatically that you're dramatically improved by taking wheat out of your diet for 3 or 4 weeks. So again, typically what I'm gonna run is something called the wheat Zoomer, and that's a 24 antibody panel that will check and see, do you have not just celiac disease, but non-celiac wheat sensitivity? And it's a real issue. In fact, guys, it manifests when I get exposed to gluten. I get anxiety, I get depression, I get brain fog. Those are the 3 symptoms that I typically get when I get exposed to gluten. So don't think that, again, it's going to cause a bunch of gut symptoms. About, again, 70% of my clients that have gut-related pathology, they don't have raging gut symptoms. So you can't use gut symptoms as a primary outcome to tell you that, yes, you need to focus in on your gut. Jen D, and we'll talk a little bit more about how to heal leaky gut. But really, again, you cannot heal leaky gut unless you remove the insults that are driving it. And I tell this to people all the time, look, I love supplementation. I love, looking at biochemistry and using the right supplementation, and I've been doing that for 15 years. But if you don't remove the insults that's driving inflammatory changes, you'll never get the immune system back on track, which means your thyroid won't be back on track, which means you'll still be debilitated with all of those symptoms, and your doctors are scratching their head and like, I don't know why you're still tired. I don't know why you're still cold all the time. I don't know why you have terrible insomnia. And I'm going like, Are you kidding me? Like, look at all this stuff that you haven't done for this patient. You're insane. You haven't checked them to see if they have actual gluten sensitivity. You haven't looked to see if they have glyphosate. Guess what? When you consume gluten, you're getting bonus pesticides. Persistent organic pollutants, right? POPs. Okay? Glyphosate, okay, which is Roundup, right? BPA, triclosan. Yeah, that was on the hand sanitizers that everybody put on their hands, and they said, oh, don't worry about that. No big deal, right? Persistent organic pollutants, they're everywhere. So some people have issues with this, and again, especially people that have impairment in detoxification. They're going to actually suffer from these the most. Now, here's one of the crazy things is that actually iodine, the higher your iodine amount in your body, statistically, the more likely you are to develop Hashimoto's. What? Yes, epidemiology has shown that populations that have the highest consumption of iodine, which is supposed to be a thyroid nutrient, have the highest diagnosis of Hashimoto's. Meme, be careful. Ladies, first of all, if your doctor is telling you that you should go on statins, they should be actually looking at the two most common mechanisms that it's causing elevation of your lipids. One, you're insulin resistant. The number one thing that causes hyperlipidemia, right? You switching into your we call it glycolysis, which is an inefficient way of producing energy and causes more fat to be produced. That's from insulin resistance. This is also why people are fatigued with insulin resistance. They're switching from regular, normal energy physiology into something called glycolysis. So that's the first thing that drives elevated lipids. The second thing is usually, again, hypothyroidism. So if you poison the enzyme called HMG-CoA reductase, guess what? That research has been based off of men, not women. So this is why the outcomes with women are actually way worse on statin therapy. They're not even basing the research on women. You guys, most of the pharmaceutical science out there, guess what? It's not based on females. There's so many variables that they have to control for. It's more expensive to conduct that research. So again, the way that you know that you're insulin resistant is you're fatiguing after meals or you're craving sugar after meals, okay? Also, paradoxically, you can have hypoglycemia, but you're also actually in a state of insulin resistance. So if you're shaky, irritable, lightheaded in between meals, you're going too long between meals, that is your hypoglycemia. Again, for those lovely people, I recommend the continuous glucose monitor. So this company, right, is called Thea, and they are pairing with the Libre 3. So you pop this top off, and there's a little actual probe right here. And it's got a little needle, and it's pressure sensitive. So I have my clients, boom, put it on your abdomen, and basically that attaches a sensor, and then that sensor sends your blood sugar information every minute of the day to your smartphone. Okay, so it's super handy for you to start to understand, interestingly, your blood sugar is jacked up. And this is going to be probably, again, one of the root causes of hormone dysregulation, fatigue problems, abnormal weight gain, elevated lipids, right? High blood pressure. So much of these problems are tied back into insulin resistance. Remember, insulin resistance actually changes the ratio of estrogen to testosterone. And as people are insulin resistant, and the more they become insulin resistant, the longer they are insulin resistant, they're changing those ratios of estrogen, okay, to testosterone, which becomes in and of itself its own root cause issue behind Hashimoto's. Okay? This is called the Libre 3, is what this is. This is the Freestyle Libre 3, and the company that I use is called Thea. So you guys can go to my profile, you guys can go to my link tree, my bio, and you'll see more information on ordering those. Again, probably about 80 to 90% of my clients, I'm putting them on one of these CGMs when we start their care, because you need to know. And you need to be able to figure out how to regulate your blood sugar. And again, the crazy thing is that most providers are not utilizing a simple insulin test on your blood work. So the way that you're going to reverse insulin resistance is knowing what's triggering your insulin and what's pushing it outside of those ranges, high or low based on your diet. And secondly, the other main thing that's going to help you restore normal insulin sensitivity, again, is fixing something called dysbiosis. So does anybody have difficulty gas, bloating after meals, especially with carbohydrates? Love to laugh, welcome. Cheryl, that's a yes. Word, yeah, okay, we're getting a lot of yeses there. So guys, the best symptom I can tell you definitively over the past 15 years, well over, oh Lord, yes, well over 5,000 clients that I've worked with in the functional medicine model, the number one thing that raises my hackles and it's a red flag, right? That you have an abnormal ratio of good to bad bacteria in your gut is gas and bloating following meals, especially carbohydrates. Okay? Now again, not everybody's gonna have gas and bloating. And again, the crazy thing is not every time you consume gluten or a reactive food are you gonna get gut symptoms. But you may make antibodies against your thyroid tissue. So this concept of dysbiosis is absolutely critical. In fact, there's whole textbooks written on infection and autoimmunity. Now again, if you guys are hanging out here in the TikTok world, you'll be like, okay, everything's a parasite. That's not how it works. I had a fungal overgrowth. That started my celiac disease, okay? I see people with hepatitis C. That starts their autoimmune disease. I've seen people with Epstein-Barr virus. That can instigate, and especially reactivation of Epstein-Barr virus, i.e. all you long haulers out there, okay? But the number one issue that causes leaky gut and drives autoimmunity is an abnormal ratio of good to bad bacteria. Remember, if you guys were with me earlier in the lecture, I was talking about one of the most common things statistically that actually increases your chances of developing hypothyroidism is early exposure to antibiotics. When you lose the beneficial bacteria in your gut, that beneficial flora, this gut bacteria is what is regulating inflammation. As your inflammation level goes up, your immune system, it tanks. So we have to look again, where is the immune system? The immune system is in your gut. At least about 70% of your immune system is in the gut. Okay, so what should we do? Again, we stop eating the foods that are, again, causing the gas and bloating, grains. We start eating nutrient-dense foods. This is for all you guys who want to know how to fix this. We start eating nutrient-dense foods. Okay, that's going to be your animal protein, vegetables, fruit. Not all vegetables. Nightshades are out. Okay? Because again, bloating is a symptom, right? Gas is a symptom. It's not just like, oh, I just get gas and bloating. No. You're not designed to have gas and bloating. That's not how the gastrointestinal tract works. So down here, now what we're going to want to do is run something called the GI map. That is a PCR-based stool test that will actually physically tell you what is replicating in your gut. What is growing that shouldn't be there. Again, I just spoke to a woman today. Terrible hot flashes, miserable, fatigued all the time, barely getting by, right? History of hypothyroidism. And on top of that, she's just getting gas and bloating and her gut's a wreck. I'm like, well, we're going to run a stool test on you for sure. We just got the stool test back today, reviewed that with her. She has an organism called Proteus mirabilis. Guess what? That is the number one organism that's associated with rheumatoid arthritis. She has a bunch of debilitating joint pain, right? So it's not about taking Humira or Enbrel or non-steroidal anti-inflammatory drugs because you're just chasing the inflammation. For her, she has an abnormal overgrowth of non-beneficial bacteria in her gut, and guess what? She had low levels of normal, healthy bacteria. That tips the scales in favor of inflammation, and it's going to start to actually, again, cause that barrier to break down in the gut. Sarah, Proteus mirabilis. Sorry, Sarah, I'm not sure why you got muted there, but maybe you said something naughty. Okay. So the point is that now I can custom design a protocol to get rid of that, to bring her beneficial bacteria online so she can maintain a healthy barrier. She also, again, had someone who she was low levels of something called Akkermansia. So one of these commensal normal organisms, again, it's a probiotic, right? They're called commensal. Again, she's not absorbing all of her food. She's like, I can't maintain my muscle mass. I don't feel like I'm absorbing my food. And I'm like, yeah, because you don't have any of these beneficial bacteria in your gut. But one of those is called Akkermansia. Okay. And that literally makes the mucosal barrier. So the shag carpet in your gut is called microvilli. And then you've got a barrier on your gut that's called secretory IgA. That's your mucosal barrier. Well, her Akkermansia is what actually makes her mucosal barrier. So again, she had antibiotics. That never came back. So she can't dampen inflammation. She can't absorb nutrients. And guess what? It's showing up as a high TSH. So now that we know, and we're customizing her care plan, and we're giving her the right supplement, she's on the right diet, guess what I expect? I expect her to thrive. I expect her to have optimal health. I expect her symptoms to start to go into remission. She has these debilitating rashes. I'm like, whatever. The rashes, the urticaria will most likely actually dissipate. And we don't have to use immune suppressing drugs. Call me crazy, guys, okay? And believe me, people do. But I would rather focus on the reason why you have the problem than trying to chase your symptoms with disease-modifying drugs and then have you be susceptible to other serious infections, because infections in the first place are typically what actually instigates autoimmunity anyways. Do you see what I'm saying? Like, this is why this drug model is so crazy. It is a revolving door. And guess who benefits? Yes, big pharma. The drug modifying, right, again, DMARDs, disease modifying drugs, right? That is the highest profit margin of any field in medicine. So why the hell would they want you to go to a functional medicine? Why would insurance cover functional medicine? Because it doesn't. I know that's going to break some people's hearts, but the reality is you're going to have to say, I'm done. I'm over it. I need to get over this. I need to move beyond this in my life. I need to invest in my health, because those doctors are stuck in a model that's antiquated. They're treating acute problems, right? They're treating a chronic problem with an acute care model. And every problem has the same solution. It's a pill for the ill. So you have to advocate for yourself. You have to start finding someone who's going to hold you accountable, who cares about you, who is willing to take your healthcare dollars and put them into the right buckets. Do you have a gluten problem, right? Do we have an environmental component? Do we have a hormonal connection to your immune system? Do we have gut issues? Do we have insulin resistance? And I'm telling you, there's a bunch more when it comes to these mechanisms. I just don't have enough time to go through all these issues. But the point is when you get a good, comprehensive 90 marker panel, which is what we do for our clients, and you have a good, comprehensive sit down, like an actual person having a real conversation with you, which is what functional medicine is. It's personalized medicine, right? Then someone can actually say, hey, this is what you haven't done. This is what's going on with you in your labs and your kind of predisposing factors. Here's what you need to do specifically to your issues. Star G, yeah, for some people that's heavy metals. I saw a guy this week and he had elevations of mercury and he had elevations of lead. He's a welder. So he got bit by a tick. he actually got bit by the Lone Star tick. He can't eat mammalian products. He can't eat meat. But I was like, man, there's something else going on here. You're super inflamed still. You've been he's like 100% on his diet. And I'm like, there's way more issues going on here. So sure enough, he's got BPA in his system. He's got lead. He's got mercury. He's got mold in his system. He's got all of it. So I'm like, okay, cool. We're going to help you detoxify that. We got his stool test back. We're going to get that corrected. Remember, again, you guys, gut before liver. Gut before liver. Remember, your gut is your number 2 detoxification organ. But if your gut sucks, you're going to dump all of which sucks into the liver and make that liver work harder. Liver is where we convert thyroid hormones. The liver is where it's actually, again, helping us to maintain glucose stability. So here's one of the things, again, that you guys would know that would trip you off to know that you have insulin resistance. You wake up at the same time every night. You can just set your alarm. Oh, 2 a.m. Yep, I don't even have to look at my clock. It's 2 a.m. because I woke up. Anybody out there dealing with insomnia, sleeping issues, wake up, they feel beat up every morning? God, I wish I could sleep better. Number 1 root cause behind insomnia is dysglycemia during the day because you can't lay down glucose into glycogen, which is what's keeping your blood sugar stable during the night. And you're not going to get deep sleep. So again, very commonly, one of the main mechanisms behind insulin resistance is your gut. When you're inflamed, you're going to lose sensitivity to insulin. When you're inflamed in your gut, you may also actually decrease your ability to, guess what, make something called elastase. That's a carbohydrate digestive enzyme. So literally, you can't break carbohydrates down effectively when you have gut dysbiosis. So again, the fascinating thing to me is that I see these patterns over and over and over again. And again, I'm looking at the mainstream medicine to start to catch on to some of this stuff, but I've been doing this for 15 years and they still are absolutely clueless about all of these issues. And I expect that to continue. Wendy, I'm 100% online. I actually live in Colorado, and I had a physical office here in Boulder, Colorado for 13 and a half years. I'm exclusively and 100% now just via Zoom. So again, if you guys want to tackle and actually understand what's really driving this, you need to start with labs. Again, for our thyroid, we're going to get 8 markers, right? So you're going to get TSH, reverse T3, TPO, and then again that thyroglobulin antibodies. Then we're going to get T3, free T3, T4, and free T4. That's my minimum as far as what you need as far as for a thyroid panel. But it's way beyond that. You need to test your insulin. You need to check your vitamin. I didn't even talk about vitamin D. Vitamin D. And you guys are like, hey, yeah, vitamin D. I can't get my vitamin D up, guys. I know you're taking vitamin D supplementation. You're either taking the wrong dosage of vitamin D or you're not absorbing it. Remember, one of the actual other triggers and mechanisms of thyroid disease is your gallbladder. Has anybody lost their gallbladder? Cholecystectomy? Hello. Bueller? Me? Yeah. Well, guess what? Your gallbladder releases bile. And now that you don't have a gallbladder anymore, if you're not adequately releasing bile into your gut, again, we'll put gallbladder right here. Gallbladder. Boom. You're going to cause dysbiosis. So yes, you need to be on bile salts. You need bile salts to break your fats down. Your fats are critical as far as for your immune system. But on top of that, your bile actually helps not just the digestion, but the regulation of your immune system. If you're seeing low levels of iron, anemia, it's not just because you have a bad menstrual cycle. Oh, you just need iron supplementation. You guys, you're not absorbing. So we have low levels of beneficial bacteria. We may have high levels of bad bacteria. But again, the insanity is that doctors are not, right? they are not doing adequate stool testing. Look, you can do a colonoscopy, you can do an endoscopy. There's nothing wrong with those tests. I mean, they do kind of mess up your glutathione. But outside of that, if you do find things, that's great. But most people don't find things because it's a macroscopic test. Stool testing, if it's PCR-based, polymerase chain reaction, that is a microscopic test. It's showing you what's going on at the microscopic level. And yeah, you can go anywhere and buy bile salts. Ox bile is the most common version of it. It's not going to fix everything, but again, guys, it's about how many boxes you're checking off. As you start to deal with the issues of why you're developing leaky gut, as you're starting to take the right nutrients, as you're starting to actually unravel the mechanisms of what's causing it, as you start checking these boxes off, so do your symptoms improve. Look at all those fruit. My goodness. Thanks, Star G. So again, if you're in this frustrating situation, right, where, hey, I had a COVID infection, or I got the vaccine, now I have a thyroid issue, or I'm postpartum, and then I developed a thyroid problem, or I'm menopausal and I developed a thyroid problem. These are all the people that I see on a regular basis. It's about understanding what's driving your mechanisms, about what your diet is, about what your lifestyle is. We didn't even talk about cortisol. Huge. Stress is a killer. But if your doctor's not testing it correctly, if he's not identifying that you have a cortisol problem and then showing you have a cortisol problem and then correcting that cortisol problem with the right lifestyle, the right supplementation, the right dietary changes, that is what you're missing as far as your health care goes. Because that, again, what you're getting right now is sick care. You're getting a hormone to address a fundamental change and an abnormal physiology, and then basically you're out the door, away you go. Miss Diaz, the discovery call is just a 20-minute phone call with staff. So you're welcome to have that. There's no cost as far as a discovery call. It lets you speak to my staff about becoming a new client. We ask people that grab the discovery call, you need to be willing to change your diet. You need to be willing to take supplementation, and you need to be motivated. So we only have a certain number of discovery calls. So we just ask people to just make sure you're pretty serious about becoming a client. Maybe you just need to have some clarification, like, does insurance cover this? No, because that's the most common question, so that's why I always answer it. Again, guys, also just so you know, we went through a lot of information on this lecture so far. If you want to get the full lecture, I'm going to load this up to YouTube. So you just need to email info@drautoimmune.com, and at the latest by tomorrow, we'll email you the link for YouTube so you can actually watch this lecture at your convenience. Okay, so yes, the appointment is virtual. I'm 100% online, right? So again, basically what that looks like, and we'll get some more questions here soon, okay? So again, basically, new patient eval, it's $350. First thing, right, is the discovery call. So you're gonna see a link in the bio, and when you click on that link, it'll actually give you the option of scheduling that discovery call. So you'll do that first. You schedule that. That just talks to your staff. Then we'll get you set up with the drop ship of the test kit, right? So then, two, right? I guess you'll pay the $350, three, right? I'm sorry. Let's have that. That's backwards. So you'll schedule the discovery call, okay? Next thing is you're gonna pay the $350, right? Then you'll have the call, okay? Then you'll get a kit, is drop shipped, okay? You get your blood test done. Again, like I said, it's a 90 marker blood panel. A lot of information. By the way, you're getting a huge discount on that first blood draw, and we pass that discount on to our clients. So that if you build insurance, that's actually over a $3,000 blood test. but we use a company called Vibrant Labs, and they're pretty awesome. And they give us a serious hookup for the number of labs that we do for them, okay? So you guys can say that your labs are free, but you're still dealing with all the issues that you have if you have socialized medicine. So don't give me that thing that that's free. Your citizens are paying for that health care, and as a result, you're getting shoddy healthcare because all they're doing is using an acute care model to fix chronic problems. So don't tell me that healthcare is free. And if you want to have that conversation about acute care healthcare and why we should cover emergencies, I'll have that conversation with you. But if you guys keep doing the same thing over and over again, obviously, i.e. a drug model, and you expect a different outcome, that's the definition of insanity. Okay, so it's a phlebotomy. Okay, and so you get that 350 includes the phlebotomy for most people. You just go into Vibrant, you'll find a place where you can actually have it drawn. So the kit is drop shipped, right? There's 16 pages of paper work. So you got to go onto the portal, you fill your paperwork out, and then finally, right, we have our 90-minute eval. That's where I will give you my best care recommendations. That's where I will actually start to break things down to you. That's where we'll start to make recommendations. If we need follow-up labs, we'll talk about supplementation. We'll talk about, hey, look, how long do I think this is going to take? I will say just in general, most of my clients within the first 30 days are already dramatically better. If you truly have autoimmunity, you're looking at probably a 4 to 6 month process. The first initial 2 months are the hardest part of this because you're really having to change your lifestyle, you're having to change your diet. But ultimately, again, if we can change your exercise so it works for you, if we can get your sleep back on track, if we can get your blood sugar regulated, if we can get your gut back on track, if we can start utilizing the correct supplementation to what you actually need, this is why functional medicine changes people's lives. And again, it doesn't have to cost $10,000 to do that. So the point is that it needs to be customized to what you need and individualized, but you're going to have to make a decision that you're no longer putting up with the BS. Right, Star G? She's been giving me all sorts of gifts. I appreciate it. And so the point, right, is that if you've decided, hey, look, I want to be the best mom, I want to be the best spouse, I want to get back to working. You know, the gal that I was talking to you guys tonight had the overgrowth of Proteus mirabilis in her gut. She's not even able to work. But she knows if she doesn't fix this issue right now, she's at this point where she's going to have to go on to disability. And she's like, I don't want to go on a disability. I want to get back to working. And I'm like, I'm 100% with you right there. Let's get these issues fixed. Let's get you back to work. Let's get you back to society, right? So yes, $350 includes all of that. Again, I'm going to give you a care plan. I'm going to talk to you about, hey, look, here's what our next steps are. So no, it's not including like a regular functional medicine visit, or if you need a GI map, okay, or if you need a Dutch test, that's not included in the $350. But again, I'm going to prioritize what I think you do need as far as labs, because labs change recommendations. That's the point of labs. It's not just to say, hey, I'm a doctor and I did some labs for you. No, like it's supposed to be pointing you in the direction of what you should be treating so you can help your client. Yes, it includes all those labs. The 90 marker eval is included in the $350. Okay? It was actually $299, but again, Vibrant, our labs, they actually bumped their price up. So I'm sorry, I'm not going to lose money on you guys, I know. But the reality is we still have to kind of cover our minimum. But you're getting a huge discount on this, again, just the initial blood work panel. So again, like I said, our criteria for people getting the new patient evaluation is you're willing to change your diet, you're willing to take supplements for what your root causes are, and you're motivated. If you're not motivated, you're not going to make changes. There's no point in us having this consultation. Please don't waste my time. Okay? All right. Miss Diaz, the stool test is $420 for the GI map. Okay? Yes, Julie, Andy, both FSAs and HSAs are accepted. And yes, you will have to change your life. And you will have to change for life if you want to maintain your results. Again, guys, I am really very blunt and honest with you about what's going on. Because you know what? Your doctors are not. And as a result, you've been given bad advice potentially for a lifetime. And so I'm very nice and I'm very polite, but I am very blunt and I'm very much to the point because I don't have time to waste. You guys don't have time to waste. And as you start to realize that this is what your life has now become, is just doctor's visits or taking a medication, I'm telling you, man, the best thing I can do for you, if I think it's true, is to give you vitamin H. Not vitamin Holloman, okay? Vitamin H is hope. When you guys can get some hope that actually this can change, like the joint pain and the fatigue and the brain fog, that it can change, I'm telling you, it's amazing. It's just such a blessing to be able to see and work with people on a day-to-day basis that they just want to get better. And that's, again, ultimately really what I care about. My mark of success is getting a fabulous testimonial, right? Because people are so thrilled with their results. So again, it's about 4 out of 5 of our clients that we actually have fantastic results with. So we have about an 80% success rate in our client base right now. Okay. So if you're Star G, if you're from the Cayman Islands, if you guys are international, you just need to reach out to my new patient coordinator, Nancy. And so that email is info@drautoimmune.com. Okay. If you guys want a 3-day diet guide, if you guys just want some recipes, you're like, hey, maybe I want some ideas of some recipes to use that Dr. Autoimmune recommends. Go to my link tree, go to my bio, go all the way down. There's a 3-day diet guide that you guys can download. Just some suggestions, maybe just you'll get some ideas, but you're also gonna get a little bit of a feel of what we recommend as we bring you through the first month of care. Yes, I can move. Someone's like, get out of the way so I can screenshot that. That's only if you can read my handwriting. So again, new patient eval is $350. You schedule a discovery call. This is the button that's up there in TikTok, right? The link in my bio. You'll pay that $350 after you schedule the discovery call. Again, the discovery call is 20 minutes. Okay, you'll have that call with staff. You'll get the drop ship of the test kit from Vibrant Labs. You'll fill out your paperwork, and then we get the labs back. That's when you're gonna have your 90-minute evaluation. And this is where, again, we give you best care recommendations. Okay, so that's where I say, hey, look, this is where the rubber hits the road. This is what you got to do. Yes, and I can write that email on the board. All right, so info at Dr. That's if you can read my handwriting. It's a little bit glary up there, but info@drautoimmune.com. So what else we got? Blair, the test is 90 markers. So I'll run you down what those are. It is an antinuclear antibody. It is, so that's looking at like lupus and scleroderma, Sjogren's. So it's kind of like a screening test. It's going to look at your immunoglobulins, G, A, M, and E. It's going to look at a COMP14 and other markers, metabolic markers, so liver, kidney function, etc. Complete blood count, CBC with differential, so that's your white blood cells, red blood cells, etc., and the differential of those markers. It's going to look at your lipids. It's going to look at your homocysteine, C-reactive protein, high sensitivity. It's also going to look at your vitamin D. We're going to look at a complete and total iron anemia panel on you. So that's ferritin, serum iron, transferrin, etc. It is also going to look at a 14-marker hormone panel. So prolactin, DHEA, progesterone, estradiol, testosterone, sex hormone binding globulin, etc. What else am I leaving out of that? I think that's pretty much the majority of what that panel covers. So it's literally about 90 markers. Oh, I missed out. So A1C, of course, and insulin. Yeah, so those are covered too. Critical. We got to know what your insulin level is. Okay, and it just said, great, you've just gone live for 90 minutes. Don't forget to take a break. Cortisol is tested. ACTH is not a test that you routinely check in outpatient. ACTH is checked via an ACTH challenge test, and that is inpatient only. So no, I don't check ACTH on my hormone panel. all of that for $350. Yes, all of that is for $350 and 90 minutes of my time for an expert. And that's not just me, but I lecture to other functional medicine providers, okay? I've been featured on award-winning documentaries for thyroid disease, okay? That is 90 minutes of my time. That is a 90 marker blood panel. And that is where, again, I'm going to give you my best recommendation. Now, again, the thing is I only have so many of those available. And this is why we tell people, unless you're serious about making changes, unless you're serious about changing your diet, unless you're serious about taking supplementation, please don't sign up for this. I don't want to show up to a visit, and within 5 minutes, I will quickly figure out if you're not the right fit. I'll still be polite to you. I'll still give you the information, but we're going to be done at that point. Because if you're showing up and you just want some results on the blood work, you're wasting my time. I want to work with people who want to change their life. Jamie, it doesn't matter. Again, Jamie RN, digital marketing, doesn't matter if you got some of those labs done, you will not have all of the markers done that I need to get done. I will not rely on other physicians to have labs done. They just won't do it. And then here's what happens. When you get your labs done and then if they're incomplete and you think you're going to get an appointment, then I would have to get you another requisition. We'll push you out at least 2 to 3 weeks to then get you back into my office, and you're going to be super frustrated. So again, believe me, again, I've been there, done that. I've been doing customer service for 15 years with clients. I want people to know what they're getting into. I want them to have an expectation of what they're getting, and I want to deliver on that expectation, okay? Nor 50 micrograms of levothyroxine has nothing to do with balancing a thyroid peroxidase antibody. You cannot treat autoimmunity and Hashimoto's with a hormone replacement therapy. There is nothing remotely close. In fact, again, if you look up and you go onto Google, levothyroxine is a hormone replacement therapy for lack of thyroid hormones. That's all it is. It takes about 2 weeks for us to get blood work back. Sometimes it's a little bit sooner, okay? But it's about 7 to 10 business days for most labs. Crohn's, we work with Crohn's all the time, my dear. IBS would be a typical case that we would work with, so absolutely. Vertigo can be related to autoimmune and hypothyroidism, absolutely. And again, one of the most common cross-targeting in autoimmunity from the thyroid is actually your cerebellum, which is where you actually integrate all the signals from your vestibular system. So very commonly, people get cross-reactivity from thyroid autoimmunity to cerebellar tissue, and this can actually start to cause vertigo for people too. Now remember, you may also have Meniere's. Meniere's is autoimmune. Colm, no. So again, if you're not in the United States, you need to, if you're internet, look, I've got clients in the UAE, I've got clients in Great Britain, we just started a client in England, I've got clients in Canada, we've got clients in South Korea. So, but you need to email info@drautoimmune.com because the process is different, because some countries I can get labs to, some countries I can't get labs to. So it really just depends on what country you're from. So you just need to reach out to my staff. Sassy girl, it's health coaching. We're not practicing, okay? That's why we're allowed to go over state lines. We also are gonna have a doctorate of nursing, Dr. Jolene, and if she needs to manage medications, she can do that over across state lines. She has her the national ability to manage medications. Again, most of the time we don't. Most of the time we don't even mess with people's medications because we don't even want to take on that variable. We want to fix all these other issues first, and we actually send people back to their providers typically if they need medication management. All right, anything else for y'all? I've been here for 90 minutes. The Dutch panel is $4.99, Mimi. Okay. Yeah, I like Dr. Pampa. None of his stuff of what he does is individualized, but I think Dr. Pampa as a person has good information and he has good integrity. But again, he's not doing functional medicine. Okay. Okay, guys. Again, appreciate you. And again, appreciate the new follows. Appreciate you guys as far as the new subscriptions. We'll be out here probably tomorrow. We'll do another live. But again, if you did not see the whole presentation and you want to get this presentation, email info@drautoimmune.com. Again, up here, info@drautoimmune.com. We'll load this presentation up to YouTube. You guys can have this and access this so you can get all this information. And other than that, you guys are always welcome to reach out with a direct message. We appreciate everyone here. And remember, just again, importantly, your body always has the ability to heal. Prayer works. It is okay to ask for things in your life, but what is not okay is to keep doing the same thing over and over again and expect a different outcome. Again, remember, you got to know what your why is. When you know what your why is, we will help you figure out the how. My job is to figure out the how. Your job is to know what your why is. Then we just need to figure out how do we get you from A over to Z. And that's what I love, okay? Again, you guys are wonderful. Again, this is Dr. Ian here, Dr. Autoimmune. Until next time, let your health soar.